Advancing health equity. Will digital health help?
My name's Jessica Smith. As you heard, I'm co-founder and CXO at SomX, which is a healthcare communications agency. We support companies of all sizes doing all different things around healthcare, very much focused on innovation with their communications. And we run the Health Tech podcast, we run Health Tech Pigeon, which is a newsletter you can sign up to, which breaks down the health tech news in brief every single week. So I am here and joined by my two fantastic panelists. We are but few, but there is a lot for us to talk about, and it's something that we're all really looking forward to discussing. It's certainly my favorite topic to talk about, and I think we are not going to struggle to fill this time. But handing over to you, Tim, would you like to introduce yourself?
Thanks, Jess. Can you hear me? Yeah. Hi, thanks. My name's Tim Ringrose. I'm a doctor from Oxford. I trained in kidney medicine and intensive care, and I'm founder and CEO of Cognitant Group. Our mission is to empower people, the population, with information and digital services to help them understand their health and treatment and take better control of their health and treatment.
See if mine's working. Oh, mine's working. So I'm Dr. Adel Baluch. I'm a practicing physician, but I also work as the Director of Medical Affairs at Ada Health. Essentially, our platform is an AI-powered symptom assessment care navigation tool. And we partner with health systems around the world to try and help patients get to the care that they need at the right time, at the right place. It's a brief introduction.
Awesome, thank you so much both. Okay, well, let's get into it. And I think health equity is a complex topic. And so before we get into the digital health side, I would love for us to just ground ourselves in what we mean by health equity and some of the frameworks perhaps around that we understand it by. So, Tim, I want to start with you. When we were discussing this, you raised something called the inverse care law. So what does that actually mean, and how does that pertain to health equity?
Well, the inverse care law was first outlined by a GP in Wales, actually, in the 1970s. He did a lot of work around hypertension and risk of cardiovascular disease. And what he noticed is that there's a tendency for the quality of healthcare services that are available to vary inversely to the needs of the population. So in other words, that means that often it's the people who need the healthcare most that have the poorest services, and conversely, the people who make the best use of services are often the people who need it least. And so that is a problem.
Perfect. And that brings me on to the next point, because I think when we talk about health equity, there are often two words that we use interchangeably, but actually mean different things. So when we talk about health equity, sometimes also we hear the phrase health equality. But which of those do you think we should be aiming for? Do either of you have a view on that?
Absolutely. I think, not quite sure if it's either or. But I think you really need both. You need top and tail, really. You need the equality of service provision. You need that to be provided, healthcare provision and also access to healthcare. But you also need the equity in terms of being able to level that playing field so that everyone can access it. So, for example, I practice in the UK, in London, and in primary care. And on the face of it, having digitizing the access to primary care is a good idea. Sounds like you're going to be making it more equal across the country. However, it doesn't mean it addresses equity. It can make it more inequitous. So I have elderly patients. I have a patient who's in their 80s, and that's very hard for them if you're telling them to go online to request their medications when all they want to do is talk to someone and get their medications. And so, often these people need help to sort of, even though mobile technology and the internet is ubiquitous, even my father uses a mobile phone to order Uber Eats. I think it's a bit different when it comes to health. I think it's important it's very clearly important you try and address both.
Right, I mean, it sounds fair, doesn't it, to give everybody the same service, but actually some people have greater needs than others. If you are giving out food to people and there's a queue of people, some are malnourished and some are very well fed, is your principle going to be we're going to give everyone exactly the same, or are you going to say the person that's malnourished needs more attention? And it's the same in healthcare. We've got to focus our resources on the people who need it most.
Yeah, and I think that's a really interesting point that you made there, where you said that obviously, I think very well-intentioned digital health solutions do exist to support health inequity, but actually there can be instances where that just isn't necessarily an appropriate solution that a certain patient or demographic of people wants to engage with. And so do you think that there maybe are specific age groups or demographics that might be at risk of being alienated by the digital health solutions that we're creating to actually address health inequity?
Well, age is the obvious one, isn't it? And we need to think about the elderly population and how can they engage with digital services. And as Adel mentioned, sometimes something that might sound accessible, like being able to have a teleconference with a doctor, is actually quite a struggle for a lot of people at an elderly age. But there are more things than that. Affordability is another important thing. If you're homeless, how are you supposed to use digital services? And then language and literacy are also very important. If your literacy level's low, it's very hard to use digital services. And if something's in a language that you struggle with, you're going to really find that difficult.
Yeah, absolutely. And I think maybe sort of extending that to how we tackle that within digital health, I think it's really important to be very mindful of those kind of populations that are at risk of being neglected. So it's so important to focus on, for example, making sure you've got language right, that you've got the culture right. For example, in the US, we have, where I do a lot of the work myself, a lot of indigenous native populations. You have Latino populations that have their own needs. And as a practicing physician, I know that at the bedside, culture is so important. If you can't talk in the language that they understand, then a lot of nuance is lost and they don't trust you. And so I think you have to be deliberately mindful of these gaps when you are developing from the beginning of the design process of whatever digital solution you want to put into place. Otherwise, you will miss them.
So with that in mind then, as digital health solution creators, what are the key things that innovators should have in mind to make sure that they are creating something that is accessible for the right people in the right place at the right time?
Well, I think I'm definitely guilty of this. I think innovators tend to design solutions that they would like to use themselves. So we've really got to pull ourselves away from that and think about how can I have the greatest impact on the health of the population and the community that I'm addressing. And so you've really got to adopt a user-centered design process involving patients and clinicians as you develop it, and be open-minded. A lot of the time we run user acceptance testing, but we already know the answer that we want. And what we're actually saying is, I want to find that my hypothesis is true. We really need to go into those sessions saying, I want to go into that where I don't believe I've got the right solution, and if they tell me I have, that's great, but I want to know what their answer to this problem is and get me on the right track.
Yeah, absolutely. I think also as clinicians, we sort of tend to try and problem solve straight away, where it's more about trying to really understand the problems when it comes to digital solutions. And actually, you're spot on in terms of making it user-centric. User design is incredibly important, and targeting those populations as well. So if you're going to release a solution in Tanzania, you're not going to use user populations based in London. Okay, so you really have to target those populations and involve them in the user research from the patient perspective, if they are patients, but also from the clinician perspective internally. And yeah, as I said, be mindful of those gaps. I think it's really important.
Yeah, I love what both of you were saying there about, user-centered design and bringing people into that process. And something that I heard Professor Bola Owolabi talk about at the NIA launch earlier this year was really profound to me, and I'm sure, maybe it may not be new, but she said that trust was the biggest determinant of health equity. And that really stuck with me, and I think I'm interested to understand, kind of to build on what you were just saying there, bringing people into that process where perhaps they don't innately trust, maybe it's a technology, or maybe they don't even trust a healthcare system. How can you overcome some of those challenges to successfully bring them in and make sure that they can be a part of that process and you are getting the answers that you need to create something that works for them?
So this is a really great question. I think as a physician, I know that trust is really important for patients, and you can have the best AI, best technology in the world, but if nobody trusts it, no one's using it. I was actually at the conference in the US a week ago, and they were talking about this topic. And I think it was the president of the AMA. He quoted a study which said that, paraphrasing, but essentially, patients are less likely to trust a physician if they're using AI than if they're not, even if they're wrong. They're more likely to trust the ones not using AI, even if they're wrong. So, and we have a lot of other studies that show that one of the critical factors in the patients accepting technology are clinicians recommending them. I think there's been major studies in the UK showing that. So I think, absolutely, this is critical. And I think clinicians need to play a role in this as well as patient advocates.
Yeah, absolutely. I mean, we live in the age of misinformation, don't we? And it's incredibly hard for people to know what to trust. If you only have to look at COVID and the anti-vax movement to see how insidious some of this misinformation is, there's misinformation and there's disinformation where there's an intention to mislead people. So it's very hard for people to make the right decisions about their health. So as you say, Adel, I think it's crucial that clinicians are able to recommend resources and information to patients, and that we build services where people can evaluate information for themselves, but have a level of trust that they can build upon that.
Yeah, I think you're right. And so, I guess the big question, the title of this panel, where do we think the big opportunities are for digital health solutions in terms of tackling health inequity? Because there are often two types of innovation in this space, aren't there? Because you have the solutions that are very much focused on tackling health equity itself, and then the solutions that are existing to solve another problem, but factoring in health inequity and perhaps the way that they do it. And do you think there's a space for both? Do you think that one is perhaps more important or likely to be more successful than the other? Or how do they interact with each other? What do you think?
Again, I may be going for a bit of a vanilla answer, probably both again, sorry, not being that controversial, but I think definitely there's a lot of, I don't know if we mentioned health deserts, but that's definitely one area where I think digital has huge promise in terms of serving underserved, improving access to care for underserved populations. So I think I was speaking to some medical students earlier about when you qualify as a doctor, you're more likely to go and work in a city, right? So if you look at a heat map of physicians, I saw one for the US where basically, you're not going to go and work in rural Minnesota. You're probably going to work in Manhattan or, somewhere where, there are other people, basically. So there's a big sort of gap in there's a big opportunity there as well as a gap in terms of, being able to level the playing field. COVID accelerated this with digital medicine, telemedicine, to primary care, specialty care. One of the big problems we see in my space is one of the biggest questions people ask is about seeing a doctor is, do I need to see a doctor? And so rather than travel 6 hours, drive 6 hours to the nearest hospital or secondary, tertiary care facility, if you can get your problem triaged at least, or sorted, ideally sorted at a distance, but also there's huge potential to upskill workers in those communities, so pharmacists with sort of iPads with AI-powered clinical decision support can be allow them to practice at the top of their license and not have to, for them to have to commute all the way to see a doctor. I think there, a lot of opportunities there.
Yeah, I mean, I think digital health and medtech services don't all have to address health inequalities. And let's face it, if you provide a service that allows people that want to help themselves and that can help themselves to do it more effectively and perhaps avoid going to see a GP when they might otherwise have sat in the queue and taken up a GP visit, that's a good thing, because if we've heard this morning how capacity is such a big issue, how under-resourcing and staffing crisis is causing problems. So anything that can ease that means that the limited resources that we do have in healthcare can then be applied to the people who might otherwise not have got so much attention. So there's definitely a benefit there. But I think alongside that, we do have to think about health equity and think about how we can have the greatest impact. Because if you're a startup or you're providing a service, you want to have the biggest impact, don't you? I mean, that's why we're doing it. And the World Economic Forum came up with sort of 5 suggestions about how we can use medtech to alleviate health inequalities. And I think they're very useful things for us to all think about, whatever solution we're doing, because they're quite simple. And I think we just need to ask ourselves, are we doing at least one of these things? And the 5 things are you increasing accessibility of reliable, trustworthy information? Are you increasing people's access to medical expertise? So if you've got a health problem and you can get an answer through a digital service, and that doesn't mean you need to go to see the GP, that's a good thing. Are you increasing access to medical services? If you need a test, is it going to be easier? Are you going to improve population health? Because we haven't really talked about population health. It's not just about direct care, it's about care of the nation or the population. And the 5th thing, are you actually reducing cost? Because let's remember that about 50% of the global population don't have access to basic health care. So if we've got to reduce the cost of healthcare, we can't all have a healthcare model that's as expensive as it is in the US and other developed nations. We've got to look at how to reduce cost. So if we can do at least one of those 5 things, we'll be helping to reduce health inequalities.
So to talk about cost, I have a favourite question when I talk about health inequity. So I want to finish on a high. I even managed to lever this question into a panel I did last week on digital biomarkers. So I want to hear what both of you have to say. But you were talking there about cost, and we know that sometimes in tackling health inequity, it's not always ROI positive in the short or even medium term. Sometimes those cost savings come later, or those efficiencies come later. And we also know that there are, to come back to your point, the very first question and topic that we talked about was the inverse care law, where often the people who make most use of healthcare services are the people who don't need them as much, and the people that would benefit more don't have so much access. And so we see a lot of digital solutions perhaps going to a consumer model first, where they're able to get more commercial traction because that's where the ROI is, where we know that actually the greatest benefit is perhaps to people who don't have the disposable income to be able to access those technologies. And so my question is, how do you think that we can incentivize, whether it's innovators or health systems, to put more of a focus on bringing these technologies that we know are going to have an impact to the people who are going to need them most? I appreciate it's not a simple answer.
In 40 seconds that we have left, I guess... Look, it takes time to embed these, as you mentioned, these technologies. Having worked in the space for a while, you really need commercial partners that are patient and see the longer-term view and longer-term vision, because it takes time for health literacy to embed in those populations. It takes time to iterate on technologies, because that's what it is. We never dealing with the finished product. We implement products, but product the product never, the life cycle, the software development life cycle continues after deployment. So in terms of incentives, just very briefly, I would say, I think there's ways of addressing that. There's maybe contractual ways of contractually putting that into the KPIs, but also I think regulation might have a role here and addressing some of these equity issues. And it's important to have a sense of clinical governance as well within these companies. And what's the driver? Is it purely commercial? Is the partnership purely commercial? Or are we, I think there's some alignment of values needed there as well.
I think all that's true. And there is another aspect, and that is, I think we need to invest in upskilling the population. First of all, we need to make our services stupidly simple to use. That should be everyone's mission, to make their service really easy to use. But there's some good evidence that if you invest in upskilling the population who are less digitally capable, there's a big return on investment. There was a investment in the UK by the Good Things Foundation where they found that if you upskill people who would otherwise be digitally excluded, there's at least a 6 to 1 return on investment. People feel more comfortable, they'll use services, and what they found is that their utilization of things like GP visits reduces because they feel more confident and happier about their health. So I think there's also a way that we can make our digital services more equitable by upskilling the population.
Fantastic. Well, thank you so much. 2 really solid answers there. I feel like I can go away feeling satisfied with that now. So thank you so much. But are there any questions from the audience before we wrap up? Perfect. I think we can send you both on your way to lunch. Thank you so much.